Almost 3 dozen people who come to Trinity Church every Sunday have or had cancer. When you have cancer, it's one of the first things you think about every morning. Sometimes it's the last thing you think about when you go to bed at night. And with cancer comes fear, anxiety, worry. Is the cancer growing? Will the treatment hurt? Will the treatment work? Well, anxiety and fear with cancer is the same kind of anxiety and fear that people have if they have heart disease or diabetes, something that is threatening their existence, threatening their lives. And right now, all of us have something hanging over our heads. That's COVID 19. Is it going to get worse? Well, I get it. Do I know someone who has it? If I get it, how bad will it be? So those are some of the things that we have to deal with. And the people at Cooper Hospital, MD Anderson, of course, have volunteered 2 people who can talk about this subject with us. Please meet Dr. Phil Fizzer. Dr. Fizzer is with the college. He's a clinical health psychologist from the behavioral medicine department and from the hospital medicine department. Along with him is Kennedy Wong, and she is a fellow there at Cooper right now. She deals with this type of thing every day and has a women's support group also at Cooper to deal with anxiety and fear, of course, that being the cancer realm that we were talking about before. So let's get right into this now that we've made introductions, Doctor and Kennedy. Doctor, what are some of the ways that this anxiety manifests itself in people? What are some of the things you see?
Sure. So first and foremost, thank you for having us. We love to have the opportunity to talk to people about this very issue because, as you said, it affects countless people all throughout the day. And as you just alluded to, in many different ways. So prior to COVID, right, we saw anxiety manifesting for some people in very cognitive symptoms. These are the people that you might look at them and not know that they were experiencing sadness or anxiety, but in their head, there's this experience of rumination, right? The thoughts just keep going on loop over and over again. And so the only thing you might notice is they perhaps seem distracted, but otherwise can do their job. However, that internal experience is of anxiety. And then you have people who have the more somatic symptoms of anxiety, right? Shakiness, sweating, things of that nature, muscle tension. And the important thing to note here, and something that Kennedy and I really wanted to cover early on, is how normal anxiety is. And people look at it from the perspective of what anxiety is meant to do for us, right? Evolutionary benefit of anxiety is, and then what it actually does to us on a daily basis, right? So anxiety, right? The emotion of anxiety, the reason that humans continue to have the capacity to experience anxiety is adaptive, right? A lot of people have known it previously as the fight or flight response. You've heard this term before?
Sure.
So it's just another way of describing anxiety. It's this basic part of the brain, a little feature called the amygdala, right? It's the part of the brain that's meant to detect a threat and then prepare you to respond to a threat. Right. So in some situations, that's good for us, right? If you're driving your car and the car in front of you suddenly stops, right? What do you have to do? Slam on your brakes, right? So you don't crash. That's anxiety doing its job. It's detected a threat. It's gotten you to react quickly without thinking, right? It's prepared you for impact, right? Right before an impact, you'll notice your body tenses up, your heart rate gets going, your body's preparing itself for danger. Right? The cute little story that I share with some of the patients that I see here is from my first day out at Penn State Hershey Medical Center, where I did my internship. I am from Philadelphia, so being out in Hershey was already kind of a different experience. My first day on the job at Penn State Hershey Medical Center, on hospital grounds, I encountered a brown bear.
Pardon me for laughing. Okay.
Oh, no, it is. I can laugh at it now because I survived. But at the end of the day, coming from South Philadelphia, I don't know from bears, right? With the exception of the bears at the Philadelphia Zoo, what do I know, right? So I became anxious, right? My brain said, hey, that's a bear. Throughout most of human history, person versus bear, bear wins every time. You have 2 options, right? Fight it or run from it. Regardless of which option you choose, We're going to get your heart pumping. That's going to get your blood flowing rapidly. It's going to be oxygen, norepinephrine, cortisol, the things your body needs to either run really fast or fight really hard. In those situations, anxiety is really appropriate, right? It keeps you safe, right? In other situations, it misfires. Sometimes it misfires because it encounters a thought that is anxiety provoking, right? In the world of cancer, right, there is a very real existential threat. Like cancer is a threat to you, but it's not the same kind of threat as a stopped car or a brown bear, right? It is this more chronic threat. And at certain times, there is nothing more you can do to respond to it. You're already going to your doctor's appointments. You're already taking your treatments. There's no more action for you to take. And so there's no place for that anxiety to go.
Let me switch over to Kennedy a minute here to bring her into the conversation. When you're counseling women, Kennedy, in this group that you have, uh, how do you see it manifesting itself? This anxiety, this fear. The reason I say that is because I've known athletes who get so anxious that they vomit before games, and I can imagine women who have cancer and don't know what's going to happen to their bodies would feel the same kind of stomach churning thing. Uh, the more you hear about it, and one of the bad things we do is every day on the news, it's the headline, it's the headline. How Talk to me, if you would, about some of your clients that you deal with and how they talk about anxiety and fear.
Yes, and again, thank you for having me. And so when I think about the clients I have and what they talk about in their experience, obviously it's different for everybody, but some overall themes that I see are similar to what Dr. Fisher mentioned about the somatic symptoms of anxiety. A lot of increased arousal in terms of heart rate, sweating, temperature changes, as the event that is causing them the anxiety, whether it's going to their doctor's appointments, having a checkup, receiving some sort of treatment. As it gets closer or as it's happening, there's that increase in the physical symptoms of anxiety. But I think what happens to be the more distressing component is the cognitive aspect of the worry and the anxiety, because that piece doesn't necessarily go away after the appointment, after the treatment is done.
Let me interrupt and ask you to explain to me cognitive treatment. What does that mean in people terms?
Oh, yes, I apologize. So when I say cognitive, I mean the thoughts, the racing thoughts, the constant thinking about, is this treatment going to work, like you mentioned? Is the cancer going to come back? How sick am I going to feel? Is it going to be painful? The internal experience of mulling over your worries and your anxiety, that tends to be, in my patient's experience, the most distressing piece, because though the physical symptoms are uncomfortable, they often wax and wane depending on the event that's right in front of them. So if they're planning on going to a treatment that day, it might be worse. But after they've completed or are back at home or in an environment they perceive as safer, the physical symptoms might relieve. However, the thoughts often will stick with these women more consistently.
Dr. Fisher, given that of cancer, heart disease, or diabetes, those are things that we know about now and at least have some background and some history of treatments. But for COVID, this is still uncharted territory for not only us, but for the scientists, which I would think adds to the anxiety because it is more unknown. Am I on track with that?
You're 100% on track with that. One of the biggest triggers for anxiety in human beings is uncertainty. The human brain does not like uncertainty, right? And so we talk about it in terms of cancer treatment and unknown, how you're going to react to a cancer treatment, how you're, going to recover in the long term. But any kind of uncertainty is bad. And when you talk about COVID, it is uncertainty everywhere. It's not just uncertainty about the virus itself and the treatments itself, but when are we going back to school? When are we going back to, when are we going back to church, right? When is life going back to normal? Is it ever going back to normal? And that amount of uncertainty and worry about uncertainty has just led to such a tremendous amount of anxiety across the board.
Is there one particular group, male, female, or age group, that is more affected by this anxiety, fear than others?
Do you mean at baseline or during COVID?
Well, because COVID is on top of us like a blanket, let's talk about COVID.
Yeah. So no, I mean the early I mean, this is still, even from the psychology perspective, something we're just starting to study. So we don't have robust data just yet. But the early data says no, it's not disproportionately affecting any one group. Everybody is pretty uniformly highly anxious.
Mm-hmm.
To your point, the people who are, medically most ill at baseline have tremendous anxiety because they're the ones who are in the most danger if they do contract this. And so
Yeah.
there's a unique type of anxiety. And so I think the takeaway is no, no one group is being disproportionately affected, but the presentation of the anxiety will vary from group to group. It's definitely
But
going to look.
the reason I understand what you're saying, but the reason I asked the question is because from what I'm gathering, if you're younger, you stand a better chance of fighting off the virus if you get it. If you're older, 65 plus, you're more susceptible to some of these life-threatening conditions, the lung problems and the heart problems. So I wondered whether senior citizens, knowing that they may be more affected medically, might be more anxious than my 35-year-old daughter.
If you don't mind me jumping in, I actually think that in my experience working with cancer patients compared to how I'm interacting or experiencing people in my personal life, there's anxiety across the board. As Phil mentioned, I think this is a pretty universal source of anxiety right now, which is also adding to the level of distress that people are feeling, because maybe without COVID being a thing, at baseline, people aren't really prone to anxiety, but now that COVID has entered their lives, they might be experiencing a new type of anxiety. However, it's usually the content or level of intensity of the anxiety that's different among age groups, or what your medical condition is at baseline. So for example, if you are a cancer patient or cancer survivor, if you know at baseline your immune system might be more compromised as compared to a relatively healthy 30-year-old, the content of your thoughts, the experience of your anxiety might be more intense and more specific to, when I leave my house, am I going to get sick? And what, whereas a younger individual who necessarily isn't worried about their health might be thinking, how is my job going to be affected by this? When am I going to see family? When am I going to see friends? Financially, what are my concerns? And I'm not saying it's mutually exclusive. There's a lot of overlap as well. But what I'm seeing is a difference in themes and intensity of anxiety depending on what age group or medical condition, demographic you fall under.
Well, I see some potential for some domino effects that are negative effects. And by that, I mean, if I'm worried about this, I might take it out on my wife or the dog or the cat. People express themselves in weird ways where I might snap at my spouse, and I'm really worried or scared. I don't mean to snap at my spouse, but I can see me or other people doing that. Are there some exercises that you teach your people you work with, Kennedy, to deal with this, to see it coming, to head off the curve?
Yes, definitely. I think what you're describing of the kind of indirect impact on relationships as a result of this anxiety is a very common experience right now, given COVID, and also outside of COVID times. Oftentimes, our experience of anxiety or sadness or any sort of uncomfortable emotion will directly impact our relationships with the people we're closest to. So given that information, a lot of times, depending on what it is the interpersonal concern might be. So for, a certain client I'm seeing, if they're having difficulty interacting with their spouse at the end of the day because of how stressed they are or anxious they are, perhaps that spouse has to leave the house and go to work and come back. And it's not necessarily that my patient is upset at that, but their anxiety about getting sick is what's causing the conflict. I will then, help them figure out ways to manage their anxiety as an individual, whether that's engaging in specific self-care activities, seeking professional help via telehealth for a therapist at this time. So things they can engage in their individual world to help manage their anxiety, And then also think about some skills they can engage in with their partner, whether it's improved communication or different aspects of the relationship that can also be addressed. So there's kind of these two categories of, so obviously the problem is the anxiety and it's impacting you individually, so let's address that. And it's coming out sideways in your relationship as well, so let's talk about that as in addition.
Before we get into coping mechanisms, Dr. Phil, tell me about what we hear so much about today about COVID-19 fatigue. How do you see that? Is that a real thing up here, or go for that?
Yeah, so I mean, I haven't heard, well, I hear the word fatigue used in a couple different contexts when it comes to COVID. Broadly speaking, people are becoming fatigued with the fact that it is here and it's impacting their lives, right? And so it is certainly manifesting as anxiety, but in other people, it's just kind of a general sense of, I want this to be over. Let's assume this is over. Let's go back to our normal existence, right? People are tired of wearing masks. People are tired of avoiding, I work with so many grandparents who are saying, when can I see my grandchild again?
Yeah.
Why do I have to be kept from my grandchild, right? And it's moved out of anxiety and more into like anger and frustration, right? And that's the way fatigue is manifesting, right? There's certainly a physical fatigue as well. For physicians, nurses, respiratory therapists, our security guards, like literally everybody at the hospital, they're fatigued, they're worn down. So there's the physical aspect. I think for everybody, sleep is impacted. People, the amount of disordered sleep that we're seeing right now is just tremendous. We've not seen it to this degree before. Everybody's experiencing poor sleep as a consequence of this.
Well, to that point, though, Dr. Fisser, in doing my research for our interview today, one of the answers, one of the coping mechanisms was getting more sleep. So,
Yeah.
You're damned if you do and damned if you don't kind of a thing there.
Yeah. No, I mean, that's something that we really focus on. I know this is a really strong interest of Kennedy's as well. There is a type of psychotherapy we do called cognitive behavioral therapy for insomnia. It's really the preferred treatment for sleep disorders these days because hypnotics, the medications a physician might prescribe for sleep, have a fair amount of side effects and drawbacks. They can be good in the short term, but in the long term, they're not really good for you. So physicians are preferring people do cognitive behavioral therapy for insomnia, which is really just a process of looking at your sleep patterns and seeing where can we make little adjustments here, little adjustments there to get your sleep naturally back on track. Because all the things we've talked about so far, anxiety, the emotional fatigue of this, the physical fatigue of it, they're going to be amplified so much if you're not getting good sleep. And I think anybody who's experienced sleep deprivation in their life, they know when you're sleep deprived, it's worse. I know for me, when my daughter was born, she didn't sleep for the first 9 months of her life.
Or did you?
Exactly. My wife and I didn't either. And every little problem that we had became a big problem. And it was because when we don't have good restorative sleep, we just don't have the same capacity we normally do. So targeting sleep right now is a great entry point.
Well, Kennedy, let's talk about some of these things that people can do, even though the problem isn't going to go away. If you're a good Presbyterian, you could say, well, you could pray, because prayer is kind of a meditation, and that's a way to do it. But there are other steps. So, Kennedy, can you think of some other steps that people watching could say, okay, I've got a checklist of things to do to try to beat this monkey?
Yeah, for sure. There's tons of different things that are coming to mind. Just going off of the conversation we just had about sleep, like you mentioned, getting more sleep, getting good sleep is a very big protective factor, something that will help decrease your anxiety or prevent your anxiety from becoming even more intense. And so one of the biggest recommendations that we often give to clients who are experiencing difficulties with sleep is figuring out what is their current sleep routine. So their routines around sleep, determining how to reduce time spent in bed that's not, sleeping. So I know a lot of people will do work, watch TV, things like that, trying to really be mindful about what your sleep routine is and being thoughtful about how to change things out within that routine that are feasible and also going to improve your chances of having quality sleep. So that would be something that I would definitely recommend for anyone, regardless of whether they're having sleep difficulties. I think oftentimes doing that proactively can also prevent sleep difficulties later down the line. So things like, limiting the amount of light in your room where you sleep. I know alarm clocks with like big red numbers of what time it is can be really stressful for people. So we try to recommend, either putting it face down so you can't check the time when you wake up in the middle of the night, or moving it out of the room entirely if you don't use it as an alarm clock, things like that. So that would be something sleep focused that I would recommend. But I can also dive into some other non-sleep related strategies.
Give me two.
For the non-sleep related strategies?
Yeah, non-sleep.
So my biggest recommendation right now for people is what I would consider figuring out ways to self-soothe. So a lot of times when we're at home right now, working from home, being isolated, sitting with our anxiety, the best thing we can do is figure out what worked for us in bringing on relaxation and a sense of calm. And so self-soothing is this idea of using your 5 senses to come up with ways that promote relaxation. So for, me, this candles, the smell of different scents, baking cookies, that kind of thing, actively going about your day to increase your exposure to things like that. So lighting a candle that smells good. In terms of, sound, listening to music that makes you, think of happy memories or is calming for you. Touch, having a soft blanket, things like that. So I think a lot of people, it sounds simple, but a lot of people aren't super quick to think about how to comfort themselves in this moment. And I think
so like comfort food, there would be comfort tactical things.
Exactly.
Dr. Fizzer, talk to me about the importance of staying in communication with your friends, with your family at a time when you're being told not to be around them.
Right. That leads us to this conversation of the difference between physical distancing and social distancing, right? You can remain close to somebody socially without being physically near them, right? Through things like WebEx, which we're using right now, and through other means. But also we're at a point in this thing where you can gather outside and stay, safely away from everybody. So in addition to these more practical things we've been talking about, certainly reducing media intake. You can't eliminate media intake. You want to stay informed, but you can reduce it to a healthy amount. Focusing on those things that you can control. That's another practical thing, right? Acknowledging that you can't control COVID, but you can control other things in your life. Using mindfulness-based meditation, which you already kind of covered, and said is very similar to, the Presbyterian tradition of prayer. For a Methodist, the Methodist experience of prayer can be contemplative and mindfulness. But what you're really describing now, this idea for need of social connectedness, it really, the way that I would want to discuss it is through what we call meaning-centered psychotherapy, which was developed up at Memorial Sloan Kettering Cancer Center by one of their psychiatrists, William Breitbart, absolutely brilliant guy. And it's based on a book called Man's Search for Meaning. Are you familiar with this book?
I am not, sir. I'm a David Baldacci reader. I'm not.
Sure. So this is an older book. It's written by a guy named Viktor Frankl. Have you ever heard that name before?
I know the name, yes.
So, Dr. Frankl was a Holocaust survivor. And so he writes this book, Man's Search for Meaning, and several other books about what it takes to survive situations that seem unsurvivable, right? And what it takes to rebuild life, during that and afterwards. And right, so the psychiatrist up at MSK said, boy, this sounds a lot like what our cancer patients are experiencing. People who find themselves in a situation they did nothing to deserve, right? From which there is no immediate escape, right? There may be a long-term escape in treatment, but no immediate escape, right? And things are slowly being taken away from them, right? And so the psychiatrist up there said, listen, we can't compare, the cancer experience to the Holocaust experience, but the lessons Dr. Frankl teaches us remain the same, right? And the two lessons from the book are: one, understand your emotions. They're there for a reason. If you're feeling anxious, there's probably a very good reason for it. We just need to take a moment to figure out what it is that's triggered the anxiety, right? And so come to a place of acceptance of that. In all other times, when we can stay connected to what is meaningful, our distress reduces. It may not completely go away because experiencing distress is part of the human condition, right? Nobody goes from birth to death without experiencing sadness, anxiety, anger. It's part of who we are, but we can reduce it. And so Dr. Frankl says the more we stay connected to those things that are meaningful, the more our suffering reduces. And so one of his primary examples is staying connected to people, right? He identifies 4 sources of meaning. The first source is legacy sources of meaning, right? Not just the legacy that you've been building yourself, but the legacy that you're born into, the legacy that will continue afterwards. And that generally comes back to the people in your life.
So that's grandparents and grandkids.
Absolutely. So early on in this thing, my own mother has Parkinson's disease and some similar conditions. And so we didn't feel it was safe for her to be around our children, especially because I work, in a hospital, a primary care office. My wife is a teacher and is around lots of other little kids. So we made sure that we were having, at least weekly, if not more frequent, Zoom calls. Right? We were making things and going and delivering them to her porch. So we would make her food, deliver it to the porch so we can still see each other at a distance. It's not the same. And this is another lesson that Dr. Frankl teaches us. Sometimes what we do is not going to look the same as what we're used to. And that in and of itself is hard. But as long as we can find some new way of engaging, that is meaningful and that will reduce our distress, right? Dr. Frankl gives the example of being a physician trapped in a concentration camp. He would see a fellow prisoner who needed medical attention and obviously didn't have bandages or medication or anything like that to tend to the patient. But if he could do anything to ease the suffering, he could say, all right, I've stayed true to who I am as a physician. I've reduced their suffering. And so there's a meaning behind my being here. I couldn't practice medicine in a way that is perfect, but I did it, and that's better than nothing, and that helps to reduce my distress. So when you're looking to stay connected between grandparent and grandchild, parent, spouse, friends, coworkers, it has called on us to become very flexible about how we do that. Digitally, the digital tools are helpful. Social distancing is helpful. It's not the same that we're used to, but it's better than isolating, because when we isolate, it tends to magnify those problems.
I want to jump in here and cover at least one more thing before we sign off, because we're getting long on time here. Kennedy, let me throw this to you. And if you want to bounce back and forth with the doctor, he used the term mindfulness. And I've had people explain not what it is, but say it's one of the things that we need to be concerned with. Can one of you explain what mindfulness is? Is there a generic definition to it?
Yeah, so I can take a crack at it, and Dr. Fisher, if you want to jump in at any point, I know you are well versed in the topic as well. So oftentimes when people hear the word mindfulness or use it in their day-to-day, they might automatically think about meditation or relaxation or clearing your mind, not thinking of anything, that kind of thing. And what we try to explain about mindfulness is the foundational idea of mindfulness is this non-judgmental, present-focused awareness. And so that doesn't necessarily mean relaxing or not thinking about anything. It often means the opposite, which is, let me take a second and be non-judgmentally aware of what my thoughts are, what I'm thinking about, what I'm worried about, what I'm feeling, what are my emotions, how I'm feeling physically, things like that. What's happening in this present moment that I can be more aware of and not be critical of. And then moving on from there with a clear mind to then act in ways that are more in line with our values, more in line with things that are meaningful to us, things like that.
Dr. Fisher, that sounds easier said than done.
Yeah, and so most times when we talk about it, we call these mindfulness-based practices. It is a skill that one needs to build. It is antithetical to how we normally live our lives, which is what's here, what's here, what's here. We're bouncing all over the place from thing to thing. We're multitasking, right? So it's antithetical to how we have normally lived our lives, but we know it is healthy. to take this direct approach. So when we talk to people about practicing mindfulness, right, non-judgmental awareness of the present moment, we tell them to start simple. Right. First off, there's lots of great free apps. The Veterans Affairs Hospital System has a good free one called Mindfulness Coach that was developed for our servicemen and women experiencing PTSD. And it's basic training on how to really what mindfulness is training your attention, having more purposeful control over where your attention rests at any given moment. During this conversation, any one of our minds may have wandered 100 times to the sounds outside the window, to the cat behind you, right, to what's going on outside my office. And we try to take control of our attention and bring it back to what's most important. But that's a skill to be built. So these different apps and professionals like myself and Kennedy who have training in this, like we can help with that. Start small, 3, 4, 5 minutes a day if you can tolerate that. But try to do it each day at about the same time, like any other skill. If you're going to lift weights, you're not going to go to the gym on day one and just pick up 100 pounds and bench press it. No, you have to slowly build up to it, right? So it's a skill just like anything else. And to that end, it's not just for anxiety. It's great for anxiety, right? Because anxiety is all about trying to get you to react to a threat that's in front of you. And mindfulness is about being engaged in the moment and recognizing there is no immediate threat. So it is great for anxiety, but I'll also say it's just a healthy thing to do in the same way going for a walk is. We have athletes in the NFL and Major League Baseball practicing mindfulness. Their performance gets better. Music majors down at Rowan are practicing mindfulness. Their musical performance gets better. Just a healthy thing to do for your brain.
Well, I have to say this, our 20-minute conversation has turned into past a half an hour, so I'm going to put a pin in this. We obviously have 10 pounds to put in a 2-pound bag, but I would like to thank Kennedy Wong and Dr. Phil Fisser for helping us with some bullet points, I hope, that can help us all cope with something I don't see going away until there's a vaccine. I think we're just going to have to live with this for some time. So, Cooper, MD Anderson, people, thank you so much for your help. And hopefully you will both stay safe. Thank you.
So much. We appreciate it. Do the same.